If you're interested in having any sort of cosmetic procedure done on your face or body, you really should check in to make sure that you are working with a reputable business, reputable doctor. Joining me this morning to discuss the medical credentials, Dr. Brian Dorner. And Dr. Dorner, thank you for being here. And it can be a confusing world out there, the world of plastic surgery and cosmetic things that can be done for folks now. Where should they start?
Well, I think it's important to look for a board-certified plastic surgeon, and that's the starting point. But there's a lot that you have to look into it now, because some of it can even be confusing. People will say they're board certified, but they're really not board certified in what you think they are. So do your research, find out where they did their residency, and even make sure that they can do what you want them to in a hospital. Because a hospital won't let somebody who hasn't been properly trained do that procedure in their own facility.
So when you say they should check into these things, where are some places where they can find out about some of these doctors?
Well, there's a new website opening up, the Columbus Society of Plastic Surgeons. It's not online yet, but we're working on that. So the people in Columbus can actually go to a list and find out who those people are that are actual board-certified plastic surgeons.
Which would be very helpful. And if they do find one or two folks that they want to talk to about any kind of surgery, what sort of questions should they ask?
Well, like I said before, make sure they've had proper training. Make sure you know what facility it is. If it's in their own office, that's not necessarily a red flag, but you want to be careful. Make sure they're an accredited facility, that they're interested in your safety, and that they're doing a procedure they've had proper background and training on.
Can anyone do some of these procedures? I don't want to say how are some folks getting away with this, but in a way, some folks, they're still doctors, but they're not doctors in what they're practicing?
Correct. That's the area where you have to be very careful. If you're an MD, you can actually do anything you want in your own office, essentially. And that's where people are getting into trouble, is that they're branching out into specialties that they really don't have a lot of training in, and then they can do it in their own office. But it's not necessarily the best thing for the patient to decide to do. So it makes it very muddied out there, and you have to be very careful on what you're going to do.
So be vigilant if you're the patient. You have to ask the questions, the tough ones.
Buyer beware at this point.
Well, something else, and this is a totally different topic, but in your office now, you're able to see women who want breast augmentation, and the big question for many women is, I don't know what it'll look like, so I'm very skeptical. But you can kind of help them see what it looks like in the end. How's this work?
Oh, it's very exciting. We just now received a new three-dimensional camera, and what it does is you take a quick picture of the patient's body, and it will actually three-dimensionally model how their breast augmentation will look. And it's very photorealistic, and you can essentially sit there and insert any size breast augmentation you want, and poof, like magic, you have a picture of how they're going to appear after the surgery. And it
is hard for, I mean, I've seen this done for folks who want to change their hair. And that's something that's very, you know, very cosmetic, and if you don't like it, you can change it. But with breast augmentation, we're talking about serious stuff.
Yes, and you really want to do it right the first time, obviously. I mean, it's surgery. And what's nice, too, is when I'm sitting there with a patient, I can actually see into their mind, finally, what they want, which is different than just them looking at a size, because we'll tweak the way it looks, we'll adjust how the breast appears, and I can see what type of, say, implant they really want when they're really not sure how to explain it to me.
And you brought a few implants available. There's different kinds, sizes.
There are, and they are all different shapes. Like this is a silicone gel implant. And this is probably the #1 implant we put in today. But there's also saline. People are interested in that, which is really filled with just salt solution, and this one is filled with a silicone gel. A lot of people had concerns about the safety, but that's all been proven. And this implant is very different than the implant 10 or 15 years ago. So it's even more
revised
safe.
And updated and safe. And so when you see a patient, not only obviously you had this engineering, now you can take a look at pictures before and after, you also advise them on if they want that look, what's the best type to use.
Exactly. And that's where that camera really shines, because I can just look them in the eye, show them on the picture, and they go, well, you know, I really want it to look a little different here. I want a little more fullness there. And you can actually program that in, and then I can take that to the operating table and make it match up what they want.
Wow, I can't believe it. That's interesting. Well, Dr. Dorner, thank you for sharing very much. And of course, if anyone wants to find out more about you, excuse me, we have your information on our website as well.
Great.
Thanks, Doctor.
Thank you.